Good morning and welcome everyone to our annual self-reporting webinar. My name's Sophia and I'm now in the role of Head of Education and QA at the NMC, and I'm absolutely delighted to be joined today by two of my colleagues, Jackie Williams, who's our Senior Midwifery Advisor for Education, and Paula Holt, who has a similar role, but of course within the nursing and nursing associate advice and guidance space. So they will both be here today to answer your questions, as well as obviously to share some key information with you about the questions that we're going to be going through within this year's reporting period. So what are we hoping to look at today? So I'm going to cover really the purpose of the annual self-report, what at the NMC we're hoping to gain from your reports, because it is a really important part of our quality assurance cycle. We're going to talk about the very practical expectations for the submission of the report. So all of those really key points. We're going to talk you through our core question set for 22-23, including what all AEIs will be asked to answer, regardless of the provision that they are offering. We're going to spend a bit of time with the two senior advisors going through our thematic questions for 22-23. A key part of this year's ASR is going to be the programme standards declarations, which we wrote to you about earlier in the year. So we're going to talk about how those declarations are going to be made and the points you need to consider for those. And then, of course, I've saved for the end the bit that everybody is really keen to understand, which is when are you going to receive your form and when do you need to have it back to us by? And then, as I've said, we're going to open for a Q&A session, and the team will be noting all of your questions, looking for kind of themes within those so that we can really shape our FAQ document, frequently asked questions that we always send out with the annual self-report form as well. So I'm going to kick straight off, really just to examine and to emphasize the purpose of annual self-reporting, because it is hugely significant to the understanding we have of your programme and how that is operationalised in full collaboration with your practice learning partners and, of course, employer partners if you offer an apprenticeship programme. So it is about core compliance, and there is that element of all professional regulation, and we certainly gain a great deal of assurance from those self-declarations that you make each year. So please do consider the statements that you are responding to. And of course, use that function if there are exceptions to that. But of course, there is no need to wait until the annual self-reporting. If you are aware of a problem or a concern, we would strongly encourage you to contact us about that sooner rather than later, using the exceptional self-reporting, which covers theory as well as practice, and ensuring that you just ask us the questions that you have as they come up. So we've included obviously the QA team email address within the presentation. Then look within your ASR for any discrepancies that are coming through between the report data and other data that we hold, and of course the declarations that you are making, because we completely approach this as that everyone is working really hard under sometimes quite difficult circumstances to do the right thing. That is always our approach in the education and QA space, and we wish to really make sure that if we are aware of risks that perhaps are not coming across within your annual self-report, that we can have that conversation with you and that you are cited on the same concerns as we are, as part of our approach to being open and transparent. So we look at the annual self-reports to identify any risks, and examine the mitigations that you are telling us you are taking. But it also enables us to undertake that trend analysis and look at the 4 countries' perspective. We like to ensure that the issues you are reporting as changes within our minor modifications are considered appropriate and that they have been given the institution's own approval. So they have gone through a due process. With indefinite approval, we do allow, of course, all AEIs in collaboration with their practice learning partners to make minor modifications to their programmes. However, we're also in a situation where with indefinite approval of our programmes, one of the things that we risk is actually a bit of a mission drift from where we expected and what we initially first approved. QA visitors will be familiar by now with me using the driving test analogy of when does actually a series of minor changes reach a more major change, and actually is this something we should have looked at through a major modification process. So we check through those minor modifications and of course give feedback if and when it's required. So ASR, for any new education institutions who have recently become approved education institutions, or one of our existing providers who has started offering a programme against a new set of standards, be that a pre-registration programme or a new set of post-registration standards. The ASR fulfills that aspect of new programme monitoring and for some programmes over the coming year, enhanced scrutiny as well. Now, it's important that we signpost that to you because my team will extract the information they require for new programme monitoring under each of those core or thematic questions. The second part of reporting for new programme monitoring is a bespoke report, which we send out later in the academic year. But we used to very clearly signpost and say, this is your section on new programme monitoring. But in response to feedback, it is the same questions and the same key considerations that we have for all programmes. And therefore, we do that element of extraction for you. We draw that information out. It doesn't just get lost within the process. It provides us with an opportunity to explore specific themes, and this is really valued not only by ourselves but also through our other partners that we work with and collaborate with, and it leads into our support and influence, which I'm going to talk about in a moment. One thing we did last year, and we had a really good response to from yourselves as AEIs and leaders within the sector, was our good practice and innovation webinars that we shared with you. So we ran one for nursing and we ran one for midwifery. Quite a way back now, but we ran those good practice and innovation webinars for the first time, and that's certainly something we're going to do moving forward because of that good response. So please do continue to give us your feedback because it really does shape what we do and how we do it. It helps us strategically in terms of the identification of areas for future monitoring, not just, of course, on an individual AEI level, but in terms of those specific themes that we are looking at. And we are able to then put in additional perhaps supporting information or have individual AEI meetings where we're identifying areas for future monitoring, as well as kind of being cited across the 4 countries as to what that picture is looking like. Some AEIs will be aware that following the period, as was always the plan, of very rapid programme approvals going through each of the set of standards as we went through our change process to update all of the NMC standards, we are now moving into the monitoring arena, and we are going back out to actually look at and support AEIs with the delivery of their programmes, and to understand at a very granular level what the student experience and the collaborative approach is looking like. And as I briefly mentioned, this furthers our ability to support and influence. My good colleagues here, particularly Jackie and Paula, as well as many other colleagues across the Directorate in Professional Practice and beyond, are having that public voice and having those opportunities to share the work that we do within education in really influential circles. And for that, we need to understand the contemporary issues being faced within the sector. It's a huge passion of mine that we not just gather this data and put it on a shelf. We use this proactively as well as reactively to understand the contemporary issues that you are facing. So this is an opportunity for you to reflect on everything that you do and have been doing over the last academic year. And having fairly recently worked in an ASR, I am fully appreciative of how much work there is going on within our AEIs at all times. And it's a wonderful opportunity to reflect and to communicate that to us so that we understand the sector and the work and the challenges that you are all facing, as well as those mitigations and innovations that you are putting in response. So, as I say, colleagues are noting the questions and will share those with us at the end. The practicalities of the annual self-reporting. One of the first ones we always like to get clear is what is the reporting period that we are talking about. And that is the 1st of September 2022 through to the 31st of August 23. We appreciate that isn't everybody's academic year calendar, and that, of course, a lot of provision now starts at different intake points throughout the entire calendar. So it's really important that you and your colleagues contributing to the ASR do understand that this is the time period we are asking you to reflect on. We ask that all ASR forms are completed in collaboration with practice learning partners. Now, just as a point of clarity, we don't necessarily mean all of your practice learning partners. We recognise that on our system, some AEIs are maybe working with upwards of 600 practice learning locations. That would under no circumstances be fit for purpose in this way. So we are looking for meaningful collaboration where people can support and influence the submission that you are putting together. So it may be that you choose to do that through a small working group. It may be that you choose to do that through sharing your proposed answers or sharing indeed the questions at a meeting or a forum you go to. We're not prescriptive about how you achieve this collaboration, but we are asking you to detail what collaboration you have undertaken within the formation of your ASR. So all questions that we include in your annual self-report are mandatory and apply to all provision unless, of course, we specify otherwise. So you will not have within your ASR a midwifery question unless you offer a midwifery programme. Likewise, if it is a thematic question about nursing, we only expect the answer to be based on that programme. But hopefully we make that really clear. But we did have a couple of AEIs actually in last calendar year forget to include their post-registration programmes. And so I just want to make sure that it's really clear this is across all NMC approved programmes, and that includes programme components. So for example, prescribing might be operated as a module which is offered as embedded within another programme, another master's, for example. We would still expect reporting on the prescribing programme as an NMC approved programme element. So you're able to add rows to the tables that we give you. We appreciate that once you start looking at different routes through your courses, that number of programs that you have rises very, very quickly. We know that because we have 98 approved education institutions, but that translates into 1,850 routeways through the programs. So we are expecting that you will add rows to our tables, but we are not expecting you to add columns and other kind of areas of dialogue within that, please. We ask that no individual question should exceed 500 words, and we will not be clicking on any hyperlinks, so we ask that you don't include those or embed documents as evidence sources, or indeed attach multiple appendices to your submission email. If we would like evidence or documentary evidence to support the self-declarations that you make, which, because you are making that on behalf of your AEI, counts as evidence, okay, we will request it of you. All right, so please do not send us attachments unless they are specifically requested by the team, or of course our QA partners, in terms of when they're being analysed. So we do ask that your form is submitted as a Microsoft Word document. Please do not PDF it or submit it in another file. And for the first time this year, we will also be asking you to submit an Excel spreadsheet containing the data we're requesting, which is regarding satellite sites and students on each part of the programme for each area of your provision. Now, just to be really clear on what we're looking for with the Excel spreadsheet, is we are looking at intake numbers. So we are not looking at any sort of in-course attrition through this data that we are collecting. We are looking at your intake numbers starting on those programs. And if it is a program with multiple intakes throughout a year, for example, if we use prescribing again, if you teach that 2-3 times within this period, we would be looking for the accumulative intake numbers. Okay, we've put some examples in the Excel spreadsheet. Hopefully that will be straightforward and clear, but just to make it front and centre today, we are looking for the intake numbers only, rather than any kind of post attrition. All right. So the key questions that we have in place for all AEIs receiving their ASR this time around. We will also be asking, as we always do, for any programs that didn't run in the academic year, or programs that have been or you wish to have officially discontinued. We do on occasion see AEIs forget to officially discontinue a program, and therefore this is our part of our checks and balances, that number of overall programs we have is correct, and that we're holding accountability for the correct programs. But programs that didn't run has certainly been very interesting, because we have seen on occasion a shift in perhaps nursing associate programs that haven't run on a direct entry basis due to recruitment numbers, or due to changes in employers actually seeking certain programs with AEI. So we'd like to understand that, please. As I've already mentioned, we want to know how your partners have been involved in the formation of the ASR. And a really important question is about external quality assurance activity in relation to these approved programs. Now, by that, we would mean perhaps Ofsted in England, if you're looking at an apprenticeship programme, but any system or service regulators, and of course the equivalents across the devolved nations, who have undertaken a review which impacts directly on an NMC programme. And we want to understand any outcomes and feedback that they've given you. And of course, any actions that you have needed or are in the process of taking in response to that. The next area on there is your internal risk register. So this is really your opportunity to tell us and to get us thinking about and make sure we're on the same page as you. We're able to represent the sector about what is worrying you at the moment and what are you doing about it? Where do you need our support and influence to focus moving forward? And we got some really insightful information through last year, particularly around the recruitment of experienced academics into some key roles within different institutions, as well as, of course, challenges with perhaps use of agency staff within practice learning areas. So we're really interested to know what it is that you have on your internal risk register to affect NMC approved programmes, what you're doing about them, so that we can look if there's more we could be doing, or indeed what we can share in terms of those innovative good practice workshops later in the year. We ask you about the changing needs of your student groups, and that is particularly in relation to any programmes where there is not NSS data. We will be presenting the NSS data once again this year. We are not doing the direct comparison that we would like to be in a position to do, because we are aware through working with the NSS data itself that actually we don't have that ability to directly compare questions year on year at this stage. However, we will still be using your NSS data for programmes where that is applied. So the question about responding to the changing needs of students will apply to programmes that are not reflected within that NSS data. Okay, so post-registration programmes, return to practice, that sort of thing that we will be focusing on. So we will be looking for your anticipated changes in student numbers, again, by programme, and we are asking you to look at the next 2 years. However, we know that you've already started most people have started the academic year 23-24, so that will be about your current intake information and, of course, what you are planning to do in the next recruitment cycle, so for 25 to 26. We ask for your report of your minor modifications for the reasons I've already touched on, and we ask about your intended programme modifications for 23-24, so that we can guide you, if necessary, as to whether these are desktop major modification events, so that if you're going to need to plan a face-to-face, whether it'll be a 1 or a 2 day approval visit, but also that will support our programme planning in terms of trying to ensure that AEIs are able to access their first or second choices of dates for approval visits, and that we have suitable availability of experienced QA visitors able to attend those for you. So it's all asked for with a really specific purpose and intent. Okay, I'm now going to hand over to Jackie. Oh, I should have just checked. Have colleagues got any thing they'd like to add here? And I'm talking to Paula and Jackie specifically. Is there anything I meant to have covered but haven't?
No, I think that's all fine, Sophia.
Yeah.
I think the thematic questions will bring out a bit more.
Lovely. Yes, this is the deep dive section for us. So, Jackie, the first.
Thank you. So these are going to be the thematic questions for this specific period of reporting, and these are ones across all programmes. So the first one is for you to tell us around the involvement of people in your programme who use services and indeed their carers. We're looking particularly to learn about how diverse communities are represented, how you're upholding EDI, and how this underpins student learning around health inequalities. Next section of this slide, please. The other thing we want, again, across all programmes is details about the different attainment that your students can graduate with, as well as awarding gaps. Now, we want to know about the actions you're taking in response to any gaps, and we'll also need you to tell us how you know that these actions have been effective. So it's not just about telling us about the various elements, but giving us some assurance about you knowing how this has been monitored and what you have done. And this third one is particularly important. And Mott MacDonald recently has put this out in their newsletter. And I think we have talked about this morning, that we will probably put this out again to ensure that all colleagues have got these statements. And this is around when some of the practice learning hours are being used for student reflection. So we want to be quite specific in terms of the details you give us about how you integrate this into your programme, how, if it's been implemented, particularly within practice, that we want to know the hours that's being used. And of course, because reflection must be aligned to our SSA standards, how these standards are being held within the reflection. So 3 general reflective thematic questions this year: involvement of people who use service and their carers, different attainment and awarding gaps, and practice learning when student reflection is being used.
That's great, Jackie, thank you. And I think interestingly, in the awarding gaps and attainment, if you have got very short examples of really good practice in this space, it's really good to hear that on your programmes, because I do know we've got universities, we know from our last ASR, that are very different stages in terms of action planning to address awarding gaps for different groups of students. So, for example, we saw a lot of in the report last year about how awarding gaps are being addressed for people that are from different ethnic backgrounds, but particularly Black versus white students. But we saw less in terms of other protected characteristics, such as those with learning differences. So it might be that you're at different stages with different protected characteristics in terms of awarding gaps. But it's really helpful to see some of where you are and what that good practice looks like. And Jackie is absolutely right. The practice learning hours for student reflection, we're getting a lot of queries into the inbox about this for obvious reasons, about what is seen as proportionate. And, you know, those of you who have already asked this question and we've responded to you have said that the amount of reflection is very much what you would have in practice. It's proportionate to the practice experience. So, for example, you know, there's some practice environments where, because they're intense and there's lots going on that's quite traumatic, there might be the requirement for more student reflection and debriefing than there would be in environments where care is much more straightforward, whether that's in a midwifery or a nursing associate sort of position. And just a note about SSSA, you probably, I don't know whether you've noticed, but yesterday our website was updated in terms of supporting information for SSSA. Nothing has changed. What we've done is tried to unclutter the website, make it easier to see. And over the last few months, we have added in supporting information on things like indirect supervision, particularly as many of you are increasing the availability of practice experience in very different environments, including those that are outside of the care experience and nursing care settings, and those that might be abroad, those that are virtual, those that are simulated. So the new indirect supporting information on indirect supervision is up there. It's worth a look at the website to sort of see how that's been improved. I think the layout probably helps in terms of, you know, being able to see it all better.
Thanks, Paula. Next slide, Sophia.
Thanks, Jackie. Just before we move on, I wondered actually if it would be appropriate from the wider discussions that we've been having within how the decolonising curriculum work within midwifery could feed into an AEI's response about how it's underpinning student learning about health inequalities and, you know, kind of it could feed into multiple areas on this, couldn't it? Do you want to touch on that?
Yeah, absolutely, Sophia, because we've actually chosen for this to have these 3 thematic questions and then only 1 specific programme question. But we have been supportive of the Royal College of Midwives toolkit in decolonising the curriculum. And I know they are doing additional work on this, but I think for midwifery programmes, we would really be interested for that involvement of people and that second element to perhaps reflect on that toolkit and how you're proposing to use it. Thanks, Sophia.
Thank you. I think it's important we bring in wider work when we're able to, but it might also be that we want to reach out from QA actually later in this year. Yes, absolutely. Yes. It's a great conversation to be having. Thank you. So would you mind taking us through this, Jackie?
I will. So this is the thematic question for midwifery only. Midwifery colleagues on the call are all aware that we introduced this new standard in response to key maternity concerns currently. And this is about student midwives gaining experience of leadership and team working with different maternity providers. Now, we know that some programmes already will meet this standard, and we need to have information specifically about that. But if for those who have not got it already currently approved within their programmes, we want to know how you are planning to meet this standard by January 2025. We additionally are interested in always examples of innovation, particularly where this standard is being adopted in rural or remote communities and programmes are being delivered, and where it perhaps is being more challenging. And then, of course, we will then feed that into the Sharing Good Practice webinar in summer 2024, because that will be helpful for colleagues who are going to be meeting the standard by January 2025. So again, as much detail about this in terms of how it is within your programmes currently, or how you're planning to meet the standard. Thank you, and I'm going to hand over to Paula now.
Thank you very much. And obviously the thematic question for 22-23 probably won't come as any surprise, because unless you've been living under a rock, there's been a lot of things that have been in the press, in the nursing press, about field-specific learning. Now, I will sort of, from an NMC perspective, say that obviously our curricula are outcomes focused. So what we really need to understand is how those standards are being applied to ensure that, as well as supporting the holistic care of people, how field identity is being fostered within the programme. So interesting, when we asked this question last year, what we really wanted to understand was how field identity was being fostered and how students felt about their field identity and their feedback and perceptions of the field content of the programme. Because obviously we've had student feedback that's been varying. I even had one students last week that told me that their curriculum was too mental health focused and not enough adult focus, and they were adult field nurses. So just shows the diversity of how curricula are being delivered. So it would be really helpful to understand, rather than saying, yes, we're covering all fields, but how that individual field identity is being fostered within the programme. This is really important for us to understand in terms of the experience of students. We obviously get students that contact us all the time and talk about their curriculum and talk about their experience. And some will say, bit disappointing. I haven't really had anything that's been very field specific until the tail end of my programme, or I've had lots of things that feel generic, and we don't like the word generic because yes, we want holistic, but we still want people to be meeting the field specific part of their programme. So it's going to be really interesting to hear from you in this thematic question, how that field identity is being fostered, your confidence in how those field the field sort of specific element of the curriculum is being met. Because we are out and about a lot, we have this conversation with lots of universities, and I have had universities that very honestly fed back, yeah, I think we do it great for adult and mental health, but we sometimes struggle a bit with learning disability in children's, depending on who's teaching. So it's that honest appraisal of how you feel field identity is being fostered, any plans you've got to enhance or improve that. Let's be honest, we've had the approval of this particular curriculum now for 5 years, and it might be that there are changes that you may wish to be thinking about in terms of how field specific elements of the programme can be met. But interestingly, what we'd really like to hear is that student feedback on their perception of their field identity and the programme content that meets their field specific requirements. And we can talk about this later if necessary when we have the Q&As, but we really want that to be a very focused response in terms of your honest perceptions of how you are meeting that field specific requirement for the 4 different fields of nursing, or however many fields that you offer. So that was it really in terms of that one, and we can talk about it later. Thanks, Sophia.
Thanks, Paula. And can I ask you to talk about the programme standards?
Sure.
A little bit more depth
Sure.
for us.
So this should be, I hope, a fairly straightforward part of the SR in terms of you're going to be ticking boxes, if you like, about whether you're meeting revised programme standards. The programme standards we've got now are going to require some self-declaration. So we're going to be asking you about 12 different areas where you're going to be asked to make a self-declaration as to whether you are or are not meeting our standards. So if it's a yes, then obviously it's a yes. If it's a no, then there'll be a box at the bottom that's going to ask for a further explanation. I'm going to go through 2 examples with you straight after this so that you can see them. So for each area of the standards, we've given you some context regarding how any change would need to be undertaken by you. And we are likely to repeat these questions again in the next ASR so that we can monitor that these particular standards are being met through your self-declaration. So if we pop onto the next slide, you can see an example of this. So obviously we made a change, as you recall, January 23 to the standards around the removal of the EU directive and the removal of that requirement for 12 years of general education prior to admission. And then a new requirement was added to ensure that safeguarding measures were in place if students were admitted to the programme under the age of 18. So obviously the new requirement there is, if you 2.8 was ensure that for students below the age of 18 on admission to their intended programmes, appropriate safeguarding measures and any necessary programme adjustments are in place to support them and people in their care. So you just have to tick yes, we're meeting this requirement, or no, we're not. So in my experience, if I take the NMC hat off, I know that in my own university, when I worked at university, we had all of these safeguards in place because it wasn't unusual in health programmes to have somebody actually start the programme under the age of 18. So those safeguards would probably already be in place at your universities in terms of your, so hopefully that will be met. But if it's not yet met, then we would require underneath some additional information, plus any plans that you have for major modifications, if appropriate. So it's just that one's a yes or no. Some of the self-declarations have got a few more boxes to tick in terms of yes or no, and that's because some of the changes in standards we are finding from the questions that we're having are a little more complicated. So the next one I'm going to show as an example is simulated practice learning, which I think you'll agree has been something that you've been asking lots of questions about and we've been trying to address. So obviously we changed the standards in January 23 so that AEIs were going to be able to deliver up to 600 hours of practice learning through simulation. So the answers we've got here are really where you are on that journey. So if we just take a moment to go through where you may be on that journey. Those of you that were approved to deliver the recovery discretionary standard RN6 went through an approval process which allowed you to deliver up to 600 hours of the 2,300 practice hours through simulation. And you are, thank you, sending in 3 monthly reports. And in May 24, you'll be sending in a final report evaluating your experience. So you don't need to do anything, and you can say that yes, you're meeting this because you've been approved. So that would be the second yes box. So you're meeting that standard because you've been approved through RN60. You may not be using simulated practice learning at all. So you're going to be meeting that standard because you're not using simulated practice learning within your approved programs. There's a no box there because we've made changes to our approved program and are currently using simulated practice learning without formal approval. What does that mean? So when your programs were first approved, and many of you will, sorry, apologies, alarm going off. When you were first approved to deliver your program, your nursing programs, you would have been approved to deliver a certain amount of simulation. But for most of you, that wouldn't have been simulated practice learning. That would have been simulation hours within the curriculum. So some time ago, QA sent out a letter asking you to recalibrate and tell us what you were doing in terms of the number of simulated practice learning hours that you were offering. If that was different to what was initially approved, or you had increased the number of simulated practice hours during COVID through RN5, because those recovery standards have fell away, you needed to be put in a modification to allow you to continue to deliver the simulated practice hours that you are. And if this is confusing at all, happy to do a little bit more in the Q&A session. But basically, it's looking at the number of simulated practice hours that you are offering now and asking yourself whether those have been approved. Because if they've only been increased because of RN5, which has now fell away, then you should be going through a major modification, which will be desktop, to fulfill the requirements to continue to deliver those simulated practice learning hours. So if there are any questions on this, we can take them at the end. That's absolutely fine. But we have sent out a QA letter. And I know that in the last newsletter that we sent out, there was a gentle reminder. And that's because we've had more than one university now that we have found have come back to us and said, actually, we increased our hours during the pandemic and we haven't had that now approved. So we now need to do that. And that's what they're doing. And they're getting on and doing it. But some people are feeling caught out by this because they increased the hours, changed the curriculum during the pandemic through RM5, but have not yet had those hours formally approved since the recovery standard fell away. So the boxes there will give an indication of whether you're meeting that standard because you're not using simulated practice learning, you're meeting it because you've been approved to do so through RN60, or because you've already had a modification done, or no, you've made changes and you're currently using simulated practice learning, but you haven't actually had that formally approved yet, in which case tell us what you're going to do to get that done sooner rather than later. Or you'd like to make changes but are not currently using them. So it might be that you're not currently using an increased number of practice learning hours, but your intention in the future is to do so, in which case that would be the final box. So we can go through that again in slower time if you wish at the end. But this is one that we need to sort out because obviously there has been a lot of changes to recovery and discretionary standards that have led to changes in the curriculum that may not have been approved since those recovery standards fell away. I hope that wasn't too complex, but we can return to it, Sophia, later if helpful.
Thank you so much indeed, Paula. It is indeed a really important conversation that is ongoing, and certainly one that that we are really keen to kind of support and help people get right. So the key points that people are looking for before we move into the questions and answer session is we are keen to take questions from you. If following this this webinar you still have questions that you'd like to submit into the QA team, please do so by close of play on Tuesday the 14th of November. We will start working on that document following the webinar because we will pick up a lot of your questions through this, but if you sleep on it and decide you still have some questions, please submit those to us for the FAQ by the 14th of November. We will be sending out your form to each AEI on Monday the 27th of November. So that will be the date that all AEIs should receive their annual self-report. As with last year, it is a customised template to your AEI and the specific provision that you are offering, because we do have some AEIs now who do just offer perhaps one NMC approved programme, including just offering prescribing. So their ASR template will look very different to a very large AEI who is offering all NMC approved programmes. And then the key deadline date there that you are looking for. The submission deadline is Friday the 26th of January. So that is when we would expect to have received all AEI responses by. As always, we will send a series of chaser emails as we get closer towards that deadline. But you do have that for clear 2 months there. We appreciate that there is that kind of 2-week period for Christmas, but it does look like 6 weeks of time. So we would encourage you to get those meetings in your diary now with the practice learning partners that you are going to involve, so that once you receive your form, you're not kind of sitting on and waiting for that. You can be quite proactive, because we've kind of given you an idea of all the areas that we're going to be asking you about. Nothing should come as a surprise for you there. So that is everything for us in the kind of the information, the presentation stage. I'm just going to remind people of our housekeeping notes, just in case you weren't there at the beginning of the call. And in a few moments' time, I will close the slide deck, but we will keep recording while we are answering your questions. And of course, if people would like us to go back to any particular slide, then we are able to do so, and we'll share that with you. One thing we have taken the decision to do this year, and was communicated in your email invite to this, is we have recorded this session, and we are going to attempt, with our fingers crossed, to send this out proactively to all LMEs and official correspondents, so that this can be shared in that open and transparent way with your practice learning partners, with others who may be contributing to this process, so that everyone can have the consistent information, and that, yeah, we, rather than try and get you to search for it on the website, we will send it out to you. And hopefully, I'm seeing lots of thumbs up. That is a well-received step, and that's certainly something I'd like us to be doing moving forwards. Okay, so I'm going to close the slides, and if you'd like to put up your hand and ask us a question directly, please do so. And my happy helpers in the background, who have been wonderfully monitoring the chat for us, will pose any questions to Jackie, Paula and myself on your behalf if you're unable to speak for any reason. So straight off the bat, does anyone have any questions for us? If not, I will get the team to fill the space with questions that have been coming in through the chat. Suzanne, thank you very much for joining.
Hello.
Let me. Hello. Good. You can unmute.
Am I still on mute? No.
No, you've been able to. It's fantastic.
That's okay. I just wanted to ask something, because I think this did come up at the visitor training that we had in Manchester a couple of weeks ago, and I've just brought up my approval report for our nursing programme, actually, just to check exactly what it says. We were approved in March 2020 against the new standards, and it does say that we were approved for 448 hours of practice learning. But that was obviously just as the pandemic was coming in, and then so we're not being monitored in the way that programs that introduced it. You're nodding and shaking equally at me, so I'll be quiet and let you
No,
tell me what I need to hear.
It's fine, Suzanne. So the initial approval, there was some approval because we've gone back and looked through the approval reports of universities when we've been having these conversations. Some were very specific that the visitors had actually written that you'd had practice learning hours approved. In your case, if it says that, then you have 448 hours practice learning hours already approved. So you tick the second box because you're already approved.
Marvelous.
So we had other universities where it was a bit more sketchy. So we had one where they had been approved for 660 hours at initial approval of simulation. And it didn't state whether that was practice or theory. Then going back further and looking at the curriculum that had been approved, there was elements of simulation within the theoretical elements of the curriculum, which is why when we sent that form out to ask you to do a bit of a recalibration, we needed to understand what your interpretation was of that. In terms of this standard, those universities that were saying we were approved back in whenever to do over 600, then the point of the new standard is to say 600 is the maximum. Okay. So even if it said the word simulated practice in there, then it is important that, you know, that is pared back so that the maximum is 600. This is all going to be really helpful to us in nursing when we go forward looking at what the next phase of programme standards looks like, because we are going to be collating evidence, and I'm already doing that from those universities giving me RN6 reports in terms of the effectiveness of this element of practice learning, because as you know, the next thing we need to look at is what makes practice learning effective so that it's more than a question of the hours. And I know, Suzanne, we've had that conversation in several forums, including at Council of Deans. But I think this is why getting this right now, being precise with our stakeholders and the public with regard to what simulated practice looks like and how we're regulating it, is going to make it really helpful in terms of justifying its effectiveness going forward. Does that help, Suzanne?
It does. Thank you. That's great. Thanks a lot.
It's either clear as mud, Sophia, or...
I was going to say, we must have been doing a good job on the chat function team if we've managed to get to this few questions. Leslie,
but Sophia,
please.
There was an earlier question about monitoring, which was answered, but I'm just thinking for colleagues whether that be worth just saying something about. Just going right back.
Okay. Would you mind finding that, Jackie, while we get Leslie to ask her question, and then if you could pop that one forward, that would be appreciated.
Thank you. My question is about the visits, actually, and I just wonder, we have I'm at the University of Dundee, we have our non-medical prescribing programme that will go alongside some post-qualifying programmes, and we have our internal university approval next year. And then the following year, our big pre-registration programme will be approved, you know, our internal processes again. And I just wonder, do the NMC then try to combine visits, approve with what we're doing internally when we're changing, when we're reviewing and having a reapproval of our programme through a periodic programme review? Is that a possibility, or is it always quite separate?
Possible, we do conjoint events. I think what I would encourage you to do, Leslie, is look at what changes you are looking to make, because if it's anything beyond a minor modification, it would involve ourselves. And so, you know, some periodic academic reviews may look to kind of tweak reading lists and do some kind of good housekeeping style amendments. However, if it is a major modification event, then that would absolutely be conjoint, and we would want to be have, you know, our QA visitors at the table with you.
Okay, that's helpful. Thank you.
No worries.
So Sophia, the question was, so are there planned NMC visits in person, read the areas for future monitoring? And I think we have responded in the chat that's yes, but I just wondered if you wanted to just make sure that all colleagues were aware of this slight change in approach.
Yes, thank you, Jackie. So as I mentioned in the presentation, we are moving into the planned phase of monitoring programs. And so, you know, that this is something that will become a part of the sector norm in many ways. And back to kind of business as usual, and colleagues who perhaps had programs on the previous standards or have been at their AEI for a longer period of time may recall monitoring visits kind of being undertaken by our QA partner, Mott MacDonald, on our behalf, with independent QA visitors coming out to undertake that visit. The monitoring review plan with the current, they're not new, so with the 2018 standards framework actually has been updated, so it now reflects what AEIs would perhaps term Gateway 1 or Part 1 of the standards framework. So it does cover all aspects of the programme in that kind of a way, and so we are now using that, as was the intention with the new standards framework, or the revised standards framework, that we would go into monitoring against that. Now, we may be looking at one individual programme, or we may decide actually to look across programmes and do 2, 3 pre-registration programmes. We may focus a visit on post-registration programmes. But yes, we are in the monitoring, starting the monitoring cycle now. We do have also face-to-face new programme monitoring, which I wouldn't want colleagues to confuse. But again, it's very much about getting out there and understanding and seeing, triangulating what is happening within the sector to ensure that our programme standards are met.
Sophia, as well, it's probably not beyond the wit of anyone to understand as well, but with the particular monitoring that will arise just because we've got particular issues or within particular areas, geographic areas, which might not actually be manifested by the university but by placement partners, and that is entirely okay for us to say, actually, if we've got an issue in this particular NHS trust, do we need to make sure mitigations are in place to support our students that are in this group of universities that are part of that trust? So these are the sort of monitoring events that may arise because of what is happening within our areas. And again, you'll be more than aware of those sort of things happening. And I see Jackie agreeing there, because obviously we've had quite a few in the midwifery space. Can I just answer Nita's question? Is that all right?
Of course.
So Nita, thank you for your question. I guess the clarification I was looking for is, because you put if simulation hours were agreed, it depends what you mean by agreed. So if that was approved at your initial approval, yes. If they've been agreed through a recovery process through RM5, then no. So it's what was approved initially. So it's not about what has been going on. Sort of it's the initial approval and where you are now. And if that number has changed, because obviously many of us increased simulated practice during COVID, that's where a modification is going to be required, which should be very straightforward in terms of a desktop modification to say this is now what we're doing and what we're delivering. Does that make sense, Nita?
Sorry, Nita, I think you're on mute.
Don't worry.
Or we're unable to hear you. I think what I'd like to just add off the back of that is it explicit? And if it isn't explicit in the report, then we are able to, you know, support digging a little deeper underneath that. So it's not just about what is represented in the report. And although, you know, colleagues will have had the opportunity to check that for factual accuracy, we appreciate that this may not have been something that was spotted. If it is your genuine belief that, you know, this was presented as practice learning and that's not come across within your approval report. That's why we have the audit trail through the QA link. We can examine the documents and look at that. But one thing I would strongly emphasize with my approach to this being from the quality assurance perspective is, please do examine what you'd put forward there in light of the supporting information that we have published, in light of the statements and the clarification that we've put out into the sector about this. Please do ensure that what you proposed and envisaged at that point of approval meets our standards and expectations. Lovely. Do we have any further questions? Anyone like to jump on camera and ask?
The question
Nikki.
about updating some gateways. Sophia.
Yeah, hi, thank you, Sophia. It was just really query. I think somebody else put it in the chat as well. One of the issues we have is that the data we get is usually at university level for so many things, and it's not drilled down specifically to sort of nursing or midwifery. So sometimes some of the questions that are being asked on the ASR are really hard for us to answer and provide that data for. Just wondered if you had any advice about how we manage that.
I think at the heart of it, one of the things we are trying to do is to drive the approach to actually understanding this data. This data is important, not only to us, but to you, and to ensuring that the students on your nursing, midwifery, nursing associates, post-reg programs have the best possible experience and the best possible opportunities to achieve. So, you know, I think in some ways we would encourage you to push back to the organisation that actually we are a professional regulator and that this is assurance that we are looking for, and actually to understand whether or not it is within the art of the possible to create that, you know, to drill down into that data for you, because it, you know, the drive behind this is absolutely the right thing to be doing. And therefore, if that can kind of support and influence for you to have access to that data, then, you know, that would actually be my first port of call. Rather than we look for a workaround, we actually look for moving the sector forward.
Yeah, I completely agree with you, and I agree with completely having a data-driven approach. But unfortunately, I mean, the system in the university that I'm in is just, we're not able to get that level of data for many programs. So it's not a perfect science, really, unfortunately.
Do you have an example, Nikki, of the type of data that you can't get hold of?
Well, so for example, I think it was last year with the NSS, you sent it to us in field of practice, kind of specific. We never get that as a university, for example. We've never had that. So I'd be able to say what the NSS results were for nursing, but I previously haven't been able to say what the results are for learning disability or mental health, etc. So that was a really big thing for us, because we just don't get that level of detail with our systems.
That's interesting, Nikki, because I've the last couple of years that I've been looking at it, I have been able to see at different universities the field responses. So I do wonder whether it's your own university that's not actually passing that on, or whether they're aggregating it.
Yeah, I think it's the way that data is managed within the organisation.
Right.
I have pushed back with that, and we have now got that. Yeah, absolutely. But we previously haven't had that, and I do appreciate now through a certain link you can get that. But that was just one example. You know, there's other examples in terms of, for example, differential attainment and those kind of things. Sometimes we don't always have that at programme level. In terms of nursing and midwifery, we might have it at faculty level, but it's just not as drilled down. And to be fair, I mean, we're using SAP, so we've had lots of issues with it, so it's not the best system.
so Nikki, I think in things like with attainment gaps, you know, you're going to have, I mean, even if you've got faculty data, you've probably got plans in place to address those attainment gaps. And I think the quality of what you're doing and the practice that you are engaged in, academic practice you're engaging in, to try and, if you like, reduce attainment gaps, is probably going to be more important than that individual sort of data. If that's all you've got, that is better than nothing, because I suspect if it's being led by a faculty plan, you're still going to be applying that to the individual programs. So hopefully you should be able to make some sense of it in terms of the impact, because that is probably more important than the individual data, to be honest, is what we are doing to enhance the experience and the success of the student in completing the program.
Yeah, no, that's perfect. I understand. I just wanted to make the point that sometimes the data
Yeah,
systems
get
from
that.
university are not great.
I know, and you know, we're in the position where we are working in the back rooms of the NMC, if you like, to look how we can join up data better, because we've got data with HESA, we've got data all over the place, and we've been having conversations with regulators recently about how we join up, and it looks like it should be something fairly straightforward, but it, as you probably appreciate, it isn't. But it is something that we've been striving towards, and we have got people in QA working on how we can aggregate things like HESA data so we don't have to ask so many questions.
Thank you.
Thanks, Paula. Suzanne.
Sorry, I was just going to really add to that previous discussion and say that in England, I think that the Office for Students actually requires a lot of that data at subject level. So I'm sure it does exist. It's just extracting it. I mean, they have to, the providers have to provide it to continue, you're nodding. But in Scotland, of course, it's slightly different. So I'm just going to say that, yes, taking on board everything you've said there about how we can use the data we have got and talk about what we're doing. That's just been one of my learning curves moving across the border. So, yeah.
Thanks, Suzanne. Yeah, that sounds fine.
Lovely. Were there any unanswered questions within the chat?
Yeah, I think there was one in particular that got no answer at all. We have kind of been responding as we go along, but there was one from Jane quite early on, just asking if the recordings from the Good Practice webinars from July would be made available.
We will have a look. They should have been published on the website. That was certainly requested. So we will have a look where those recordings are for you.
Sophia, there was one about updating the various parts, gateways.
Yeah, gateways 1 and 2.
Yep, Rick, would you like to? You've answered it there, so would you like to come in and do that?
Yeah, of course. Without hopefully sounding like a bit of a broken record, we have been developing the QA link for consistently, hopefully, for the last couple of years. And Gateway 1 has been one of those sticking points that we've been trying hard to get done. We're kind of very close. I'd say we're in the final throes of agreeing a process, but we're still, I guess, assessing what the knock-on impact of the Gateway 1 changes would be. So the Gateway 1 changes should be hopefully available in next year's ASR. But in terms of how you update your Gateway 1, that will be done following, obviously, the ASR. You let us know usually within that you've got Gateway 1 updates to make, and then that will be unlocked for you. We just need to make sure we fully understand the knock-on impact of unlocking Gateway 1 whilst, for example, say you've got a couple of more events open at the same time at, say, a different gateway, Gateway 3 or 2, what that opening of Gateway 1 might do. So hopefully that will be done, ready and fully ready to go by next year's one. But in terms of Gateway 2, that continues to be done within the normal process of your event. So when you come to submit your next event, when you're doing the submission in the link, you have the option to start it at Gateway 2. And then within that next event, when it starts at Gateway 2, you just make your changes to the requirements as needed, and then that will obviously be assessed by the visitor. So yeah, hopefully Gateway 1 updates coming fairly soon, but Gateway 2, yeah, as usual.
Thank you, Rick. Yeah, I think it's just important to note that we are aware that unless you're one of the small number of AEIs who've joined us within the last 6 to 9 months, the likelihood is you've got Gateway 1 changes you would like to make. Opening that up to everybody at the same time, of course, could be significantly impactful. And of course, we need to work out our stance on how much change you are able to make to that on a kind of a self-declaration basis. So if you're taking down one policy, what assurance do we have that it does fulfil the requirements of the standards, etc., and how are we going to quality assure that? So it is something we're looking at, and it's something that we know the sector would like to do. But of course, in any Gateway 3, which is the programme standards, you can always provide contextual evidence which applies to your programme through standard 2.1. We have time for, I think, one further question, and Dawn has her hand up.
Sorry, it's just kind of a follow on from Bailey. So where we might not have specific changes to the narrative. Sorry, my microphone's up there. That helps. Is that better? It's because I was drinking a cup of tea whilst you were talking. So whilst we might not have changes to the narrative in Gateway 1, but a lot of our documents will obviously now be out of date, because if you remember at the time when we started, didn't we had to put all the dates on. So are we going to be required to update all those documents as well and provide updated documents that are now current? Is that going to be part of that as well?
That's a really part of what we're working through at the moment, John, because you know, policy updates, they vary, don't they? You know, they vary from very small changes, which we could probably live without, to really quite significant restructures of, you know, whole AEIs actually in the departments that people sit in, etc. So we're looking at kind of what is the fit for purpose. For some AEIs, they may want to change the narrative, particularly where it relates directly to policy X, which is no longer called that, it's now Y. So we're kind of working through what's going to be fit for purpose in practice. We are keen to stay in line with our proportionate approach to regulation. We don't want to open up a task which is really burdensome. And of course, we want to give you an appropriate amount of time to do that. You know, having been in an AEI at the point of going through Gateway 1, it was a huge piece of work. So, you know, where people have said, well, maybe if we open it for 48 hours, people could just make their updates and close it. Not practical. No, people need lots of notice. They need lots of clarity about what we're going to do, what we expect them to do. And of course, an appropriate amount of time to do that in. So we are being very pragmatic on this, and there's definitely a reason we're not rushing into it. You know, these unintended consequences. Some AEIs may have experienced an unintended consequence of our new standard being 2.8 instead of 2.22 at the end of the list. Adding it at the end of the list is one thing, but putting it in the middle knocked everything else off. So, you know, we're learning as we go, and working through kind of the unintended consequences. But I'm very keen that we don't get, if we're going to open up Gateway 1, that we don't get that wrong. That's hugely important for every AEI that we have, and of course the audit trails that we've got. So we're taking our time, but we're doing it right, is hopefully the message there. Okay. Right, any further comments or reflections, Jackie, Paula, anything you'd like to share to sum up?
No, just that I hope that people know that we are approachable enough that if there are queries that you have, please just do get in touch. It's much easier to have an email exchange or a 5-minute conversation than you feeling that, you know, you're not, you know, you've got questions that are not answered. So, you know, do feel free to get in touch. It's just easier to nip things in the bud and have a conversation early.
Yeah, I was going to say the same, because I think if there are things that suddenly come to light during the report, it's better to have those conversations early than perhaps waiting to after the report's submitted.
That's lovely. Thank you so much, Paula, Jackie, and for, of course, the team, Caroline and Rick in the background, answering loads of queries for us this morning. Really appreciated everyone's time and participation. We will now do our absolute best to get this out to everyone as quickly as possible. And I will, just before I close the meeting, put those deadline dates back up on the screen, and leave those with you. But thank you very much indeed for a really pleasant morning, and I wish you all a happy and successful ASR period.
Thanks, Sophia.
Take care.